This is the story of a past patient of mine. He was coming to see me for back pain, and we got a little off topic as it was getting closer to beach season, and he was asking me about how he can get some better abs, flatter stomach, a lot of those things that young people in their 20s want as the summer approaches. And the interesting thing I was talking to him about was how that actually related to his back pain. And what I mean by that is he had something we call, for lack of a better way of saying it, a belly pooch, right? So this is when somebody who maybe has a lower body fat percentage, so it can't be attributed to body composition or something like that, has a little bit of a pooch in the front of their belly where maybe it protrudes out a little bit. And a lot of times that can have to do with our ability to maintain pressure inside our abdomen and create pressure into our spine to better support it. So one way to actually test this, if you're at home and you want to try this out, is you simply lie on your back. You lie on your back, you pick your hips and your knees up to about 90 degrees so your legs kind of look almost bent like that. I can't really demonstrate too well with my fingers. And just hold that position and see, is the immediate reaction of your belly button to protrude up towards the ceiling a little bit. If that's the case, we're probably not pushing down into our spine as well as we could. And now we see this a lot. I see in the gym with my clients when they go to perform more higher effort activities that requires them to brace a little bit more at their abs. And if they're not able to brace effectively, then pushes back out and their belly button protrudes out a little bit. And so it has nothing to do with your body composition or having body fat or anything like that. It really just has to do with essentially that pressure pushing outward and making it almost appear as if that is the case. So for this patient I was talking about earlier, for him, I gave him a few drills to teach him to better control pressure coming inward. And the nice part is now we had another layer of motivation for it. And it just happened to be the same thing that he needed to work on for his back pain as well. Because if we're constantly letting that belly button protrude forward, your back is also going to protrude in relatively the same direction, pulling it into a little bit more of a compressive position that puts a lot of pressure on the structures in the spine itself. And then that only gets further exacerbated when we add load on top of it in the form of weights, or maybe if we're going and performing some more aggressive movements in whatever the sport of choice may be. So if you're somebody who has had a history of back pain, or maybe you're also looking for some more aesthetic benefits, well, now we can get two birds with one stone by addressing both of them at the same time, and better learning to control that pressure with exercises such as this one. So this one is a hook lying variation with our knees bent and our feet flat. In this drill, I have my arms overhead because it makes my belly almost want to extend and push forward. And now I have to breathe to learn to actually exhale, get my ribs down in the front, get my abs, like deep abs turned on. That helps to sort of keep my belly button down. And then see, can I inhale without totally letting go and losing that tension? And again, that weight gives a little bit of that resistance in this pullover exercise. So this is one example of many that we can work on here at CHP. So if you're somebody with a history of back pain, definitely contact us, because this is just one tiny little thing that we can work on to help get you feeling better, get you moving, and back to those activities that you love to do.